You know, we can come here and we can all give great speeches. We can all talk about how next year we're going to get to something, or 5 years from now we're going to get to something. Everybody in America, in Vermont, Kansas, and all over this country understands we have a primary health care crisis. This is the greatest country on earth. We spend more money on health care than any other country. It is not asking too much that when you get sick, you're able to find a doctor, that you're able to find a dentist. It is not asking too much that when you're in a hospital, there are enough nurses there, that our young people who want to become nurses are able to get that education so they go out and get really good jobs. That's not too much. That's all that we are doing in this legislation. Mr. President, most Americans understand that our health care system is broken. We are spending nearly $13,000 a year per capita on health care. That's an astronomical sum of money, almost twice as much as most other countries. And yet, despite all of that spending, some 85 million Americans are uninsured or underinsured, and there are estimates out there, believe it or not, that some 60,000 Americans die each year because they do not receive the health care they need when they need it. And our life expectancy as a nation is actually in decline, despite all of that spending. Frankly, as broken as our general health care system is, our primary health care system is in even worse shape. As everyone knows, I don't think there's any debate on this, we face a major shortage of doctors, nurses, mental health professionals, dentists, and those shortages will only grow as a result of the COVID burnout that many providers experienced and the aging of our healthcare workforce. According to the most recent estimates that I have seen, over the next decade, our country faces a shortage of over 120,000 doctors, including a huge number of primary care physicians. The nursing shortage may be even worse. Over the next 2 years alone, it is estimated that we will need more than 200,000 nurses. And despite the very serious mental health crisis we face, we're facing a massive shortage of mental health providers, psychiatrists, psychologists, social workers, etc. And on this matter, let me quote from a recent Washington Post op-ed by Elizabeth Rosenthal, a contributing editor at Kaiser Family Foundation Health News. This is what she writes, quote, and I hope our colleagues hear this, quote, American physicians have been abandoning traditional primary care practice, internal and family medicine in large numbers. Those who remain are working fewer hours, and fewer medical students are choosing a field that once attracted some of the best and brightest because of its diagnostic challenges and the emotional gratification of deep relationships with patients. The percentage of U.S. doctors in adult primary care has been declining for years and is now about 25%, a tipping point beyond which many Americans won't be able to find a family doctor at all. Already, she writes, more than 100 million Americans don't have usual access to a primary care doctor, a number that has nearly doubled since 2014. Now, what this article points out is certainly not news to the people in America. In Vermont and all over this country, our people often have to wait months in order to get an appointment with a doctor, and in some cases, they have to travel very long distances to get the health care they need. And let us be clear, there is no debate upon this. Some people think, well, we don't have to act on it now. Let's do it next year, following year. Wrong. The crisis is only going to get worse, and every day that we delay it, it becomes even worse. Now, why is this happening? Well, there are a lot of reasons why. But one of the reasons is that it turns out that the United States, despite all of our spending on health care, spends about half of what other nations do on primary health care. We spend approximately 7%. Most other countries spend at least twice as much. And the absurdity of that situation is that everybody knows that, quote, an ounce of prevention is worth more than a pound of cure, end quote. And if there's anything that Senator Marshall and I are talking about, that is exactly what we're talking about. If you spend money We are spending money to save money. Keeping people healthy saves money. Common sense also tells us that it is literally insane that millions of Americans with non-emergency health care needs get their primary care in a hospital emergency room, which in some cases is 10 times more than the care provided them in a community health center. Mr. President, the legislation that Senator Marshall and I have introduced today does not solve by any means all of the health care crises we face. But if this legislation is passed, it will not only save us substantial sums of money, not only provide a medical home for millions more Americans, not only significantly increase the number of doctors and nurses that we desperately need, but it will go a long way toward transforming primary health care in America, something that is so long overdue. You know, we can come here and we can all give great speeches. We can all talk about how next year we're going to get to something, or 5 years from now we're going to get to something. Everybody in America, in Vermont, Kansas, and all over this country understands we have a primary health care crisis. This is the greatest country on earth. We spend more money on health care than any other country. It is not asking too much that when you get sick, you're able to find a doctor, that you're able to find a dentist. It is not asking too much that when you're in a hospital, there are enough nurses there, that our young people who want to become nurses are able to get that education so they go out and get really good jobs. That's not too much. That's all that we are doing in this legislation. We are looking at the real world as it exists, and Senator Marshall, as a physician, understands that world quite well. We're looking at that world and we're saying, you know what? Let's not wait 5 years from now. We got a crisis today. Let's deal with it. And with that, Mr. President, I would yield the floor. Thank you.